Colorectal cancer can feel like a daunting shadow looming over you or your loved ones, filled with uncertainties about treatment and recovery. Are you grappling with questions about what happens when surgery is recommended? This lecture aims to guide you through the surgical landscape of colorectal cancer, breaking down complex terms and procedures into simple, digestible pieces. Imagine navigating a complicated maze, each turn representing a different surgical option. It can be overwhelming, but understanding your choices can empower you on this journey. In this discussion, we'll explore the common terms associated with colorectal cancer surgery, the types of procedures available, what they entail, the associated costs, and address some frequently asked questions. Common terms in colorectal cancer surgery. When it comes to colorectal cancer surgery, terminology can often seem like a foreign language. Let's demystify some of these terms to help you feel more informed. Polypectomy, picture a tiny, cancerous growth, or polyp, lurking in the colon. A polypectomy is a minimally invasive procedure performed during a colonoscopy, where doctors use a wire to snag and cut out the polyp using an electric current. It's like removing a weed from a garden before it has a chance to spread. Local excision, this procedure is slightly more complex than a polypectomy. During a local excision, the surgeon uses instruments to remove cancerous growths from within the colon. It's a targeted approach for stage 0 or stage 1 tumors, like surgically taking out a section of a troublesome branch from a tree to ensure the rest stays healthy. Colectomy, when cancer is more advanced, a colectomy may be necessary, involving the partial or full removal of the colon and nearby lymph nodes. Think of it like cutting out a section of a long hose that's been damaged to ensure the whole system continues to work effectively. There are two main types. Segmental resection, this is when a part of the colon is removed, along with some healthy tissue surrounding it. Total colectomy, here, the entire colon is removed, typically reserved for severe cases or underlying health conditions like inflammatory bowel disease. Open colectomy vs. Laparoscopic colectomy, surgeons have two methods to perform a colectomy. In open surgery, they make a larger incision in the abdomen. In laparoscopic surgery, they create several smaller incisions, leading to a quicker recovery time, like replacing a big window with a series of smaller ones, making the process less invasive. Colostomy and ileostomy, these procedures redirect either the large or small intestine to an opening in the abdomen called a stoma. They are like creating an alternative path in a blocked road. While a colostomy directs the large intestine, an ileostomy reroutes the small intestine. After recovery, the doctor may perform a reversal to reconnect the intestines. Diverting colostomy, in some cases, a surgeon might cut the colon above a cancerous area and create a stoma to allow stool to pass while treatment occurs. This is a temporary solution, offering relief while addressing the underlying issue. The cost of surgery. Understanding the financial implications of colorectal cancer surgery is crucial. Costs can vary significantly based on several factors, including type of procedure. Different surgeries have different costs associated with them. Insurance coverage. Your insurance plan will greatly affect out-of-pocket expenses. Additional treatments. If chemotherapy or other treatments are involved, that will increase overall costs. A study from 2019 found the average cost of surgery alone was around $19,944, while combining surgery with chemotherapy could push the average cost to $100,404. For individuals without insurance, this can feel like an insurmountable mountain. However, hospitals often provide options for reduced costs or payment plans. Don't hesitate to reach out to your healthcare provider or a hospital social worker. They can guide you toward financial assistance or government-based programs. Recovery and side effects. Every surgical procedure comes with potential risks and side effects. Recovery can vary significantly based on the type of surgery and your overall health before the operation. You might feel pain post-surgery, and for some, eating solid foods may not be possible initially. Think of your body like a factory that needs to shut down for maintenance before restarting. The bowel may take time to return to normal function, and complications like leaking or difficulty passing stool can arise. It's essential to have an open dialogue with your healthcare provider about what to expect. They can provide clarity on the recovery process and address any concerns you may have. Questions to ask your doctor. When navigating the complexities of colorectal cancer surgery, having a list of questions can help you feel more in control. Here are some essential questions to guide your conversation. Is laparoscopic surgery an option for my situation? What are the risks and side effects I should be aware of? Are there alternative treatments that may work better for me? Who can I talk to about financial aid for this procedure? What is the expected recovery time? Will this procedure remove all the cancer? What preparations do I need to make before the procedure? Should I stop taking any medications beforehand? Conclusion. Facing colorectal cancer surgery can feel like standing on the edge of a vast unknown, but understanding the landscape can make all the difference. Knowledge empowers you, allowing you to navigate this journey with confidence. Remember, every individual's experience is unique, and being proactive in your discussions with healthcare professionals can help tailor the best path forward for your situation. Whether it's asking questions or seeking financial support, take the reins of your health journey. You don't have to go through this alone. There are resources, professionals, and communities ready to support you every step of the way. By approaching this process with clarity and understanding, you can turn a daunting challenge into a manageable journey toward recovery and health. Stay informed, ask the right questions, and remember that there's hope and support available as you navigate this path.